COVID-19 has disrupted all of our worlds in so many ways, including our education and childcare services. Vaccines have been proven to be safe and effective, and are one of the most important tools we have to allow us to return to normal in our personal and professional lives. This video is intended to provide you with the most accurate and up-to-date information to make an informed decision regarding immunization. The COVID-19 vaccine is the most effective way to prevent COVID-19 infection. Hello, I'm Dr. Danielle Martin, a family doctor at Women's College Hospital and the incoming chair of family medicine at the University of Toronto. I'd like to start off by thanking my colleagues, Drs. Noah Ivers and Eyal Cohen, as well as others at 19 to 0 Canada, who've created much of the material that I'm presenting today. 19 to 0 is an independent, nonprofit organization. They are a group of experts working to support vaccination and educate people on the benefits and safety of COVID-19 vaccination. I'm here today to talk to you about COVID-19 vaccination. Through this video, I will share some information about the vaccines with you, their safety and how well they work, and will dispel some common misconceptions. Concerns and questions are natural. As a family doctor, I've had many thoughtful questions brought to me by my own patients. My family and I have all been vaccinated. I want to help you protect yourself and your family. Okay, let's get started. The pandemic is unprecedented. Experts and volunteers from across industries have come together to help solve our shared challenges. Vaccines are a key factor to ending the COVID-19 pandemic, just as they have been for the pandemics and other terrible illnesses that have come before it, such as polio and measles. The toll of COVID-19 in our province has been great. As of August 31, 2021, there have been more than 500,000 cases and nearly 10,000 deaths. That's like the entire city of Hamilton becoming ill. Unfortunately, the toll is even greater with the new Delta variant, which not only spreads far more easily, but also leads to far greater hospitalizations, admissions to the intensive care unit, and deaths. For those who get COVID and survive, the sad reality is that COVID-19 is leading to long-term complications for many, such as memory recall problems, fatigue, body aches, heart and lung damage, and sexual dysfunction, even for those who only experience mild symptoms. I know that I'm speaking to an audience of people who work with a population that's near and dear to me, children and youth. I have a daughter starting grade 7 this year, and like so many of your students, she is very excited to get back to the classroom. The pandemic has been extraordinarily hard on youth, and you know how important the school environment is for their well-being, growth, and future. As educators, the role you play in keeping our children safe and preparing them for the future is critical, not just during a pandemic, but every day. Thank you for all the incredible work that you've done over a really trying period. There is already concerning data emerging from the educational disruptions caused by school closures in 2020-21. Many students struggled with online learning, and the challenges disproportionately affected those students who are already at risk of inequities in educational outcomes, such as those from low-income, newcomer, racialized, or Indigenous communities, and for those students with disabilities. School closures also impacted student well-being. Mental health declined, physical activity decreased, and child protection risks were magnified. We need our students in school and our children in childcare. We can't always predict how severe the outcomes will be among those who aren't vaccinated, and we have a duty to protect everyone. If cases are high, that presents a risk to everyone, particularly to those like children who cannot currently be vaccinated. Currently, only those born in 2009 or earlier can get vaccinated in Ontario. However, children, including very young children, can get COVID-19, and they can get very sick and develop severe complications. One such complication is multisystem inflammatory syndrome, also known as MIS-C. It's a rare condition associated with COVID-19 that affects different body parts, such as the heart, lungs, kidneys, brain, skin, eyes, or gastrointestinal organs, and causes inflammation. The majority of children with MIS-C are usually sick enough to require hospitalization and often intensive care. When adults who are around children are vaccinated, the risk of those children getting sick is much, much lower, and they can be kept safe. There is no perfect single intervention that will prevent the spread of COVID-19, but together they all help. Let's start with the personal responsibilities, such as physical distancing and staying home when you feel sick, wearing a mask, practicing good hand hygiene and cough etiquette, avoiding touching your face, and self-screening daily. Then there are the shared responsibilities, such as fast testing and contact tracing, ventilation, quarantining and isolating when necessary, and getting a vaccine. Large school outbreaks have been linked to spread from unvaccinated adults in the school, even in schools where most educators were vaccinated. Ultimately, vaccines are the most important safety layer to help us keep schools open. They will help us get society back to normal by protecting not only ourselves, but also breaking the spread of COVID. There are many benefits to vaccination. Let's look at some of them together. Vaccines will help us end the pandemic and return to normal. They will help us stay healthy so that we can protect our most vulnerable. They will keep you, your friends, your colleagues, and your family safe. It has been a very long and difficult pandemic, but vaccines are our best path back to returning to normal. The vaccines we use to protect us from COVID in Canada and around the world are based on the same principles and science used in other vaccines for hundreds of years. The basic scientific approach to vaccination has been used for dozens of diseases and has saved hundreds of millions of lives. Vaccines work by preparing your immune system to recognize the disease, to fight it off, to either keep you from becoming infected or keep you from getting sick from the disease and passing it on to others. Let's talk a little bit about the vaccines that are authorized in Canada. As of August 31st, over 53 million doses of a COVID-19 vaccine have been administered in Canada. That's 73% of the population with at least one dose and 66% of the population fully vaccinated. In Ontario alone, more than 75% of eligible Ontarians over the age of 12 are fully vaccinated. Dr. Moore, the province's chief medical officer, has said we need at least 90% of people to get fully vaccinated. This is a goal we can achieve together. The 4 vaccines currently approved for use in Canada, the Pfizer-BioNTech and Moderna, which are the mRNA vaccines, and the AstraZeneca and Johnson & Johnson vaccines, called the adenovirus vaccines. However, the AstraZeneca vaccine is no longer currently being offered for first doses in Canada, and the Johnson & Johnson vaccine has not yet arrived in Canada for use. Again, all 4 of these vaccines are based on sound, well-proven scientific approaches and have been found to be overwhelmingly safe and effective. Let's take a deeper dive into the 2 mRNA COVID-19 vaccines, Pfizer and Moderna. Both have been approved by Health Canada and dozens of other countries around the world. These are both a 2-dose schedule vaccination, with an interval time of at least 21 days between doses for the Pfizer vaccine and at least 28 days for Moderna. These vaccines give instructions to our cells to make a specific protein called the spike protein that are on the outside of the coronavirus. The vaccines train our immune system to recognize the spike protein so that if you ever should be exposed to COVID-19, you already have a recognition of that spike protein in your body. The immune system will then attack the COVID-19 virus and keep you either from being infected or falling seriously ill. mRNA cannot change your DNA, which is protected in the nucleus of the cell. Actually, the mRNA disintegrates rapidly. It's dissolved within minutes to hours. It is impossible for the vaccine to permanently change the genetic code in your body. Getting 2 doses of the mRNA COVID-19 vaccine is highly effective at protecting you from COVID, including the new Delta variant, which is much more transmissible and more harmful. Both Pfizer and Moderna have been shown to be effective and safe, with hundreds of millions of these mRNA vaccines having been used around the world. The vaccines have proven effective for men and women as well as all races and ethnicities. With the new Delta variant threatening more people who are unvaccinated, especially our children who are not able to get vaccinated, it's important that we all get fully vaccinated as soon as possible. We know the vaccines work. They have been carefully studied in clinical trials before they were approved and have continued to be studied as they have been used across the world. Vaccines were tested in diverse populations to ensure that they were safe and effective for everyone. In both the Pfizer and Moderna trials, between 35% and 40% of the participants were Black or African American, Latinx, and Hispanic. The vaccines were equally effective in all groups. Almost everyone in Ontario who is sick with COVID-19 right now is unvaccinated. Unvaccinated individuals are 8 times more likely to catch COVID-19, 29 times more likely to be in hospital, and 48 times more likely to be a patient in the intensive care unit compared with people who are vaccinated. Okay, so let's dive a little further into vaccine development because there are some fears that the development and study of this vaccine was rushed, which is absolutely not true. We knew that there was a global pandemic and that we needed to mobilize all available scientific resources. The unprecedented amount of financial support, scientific capacity, and global collaboration allowed us to move much faster. We also were not starting at zero. As I mentioned before, these vaccines are based on the same knowledge and principles used in many other vaccines for hundreds of years. The technology used to make the mRNA vaccine had actually already been developed, studied, and approved for many years before this. All the vaccines approved in Canada went through the normal, rigorous clinical trial process. Clinical trials have 3 phases. There's the first phase, in which we determine if the vaccine is safe and if there are side effects. Phase 2 is made up of hundreds of volunteers. The purpose is to see how well the vaccine works and whether it's safe on a larger number of people. And then phase 3 is comprised of thousands of volunteers, and that's where we saw those clinical results of 95% effectiveness for the Pfizer vaccine. After the clinical trial, an application is submitted to Health Canada for review. Health Canada then conducts a thorough and independent review of all the data. They approve the vaccine if it's safe, if it works, and if it meets the manufacturing standards and the benefits outweigh the risks. Once approved, the vaccine is then distributed and Canadians can have access to it. After careful review, Health Canada approved the Pfizer and Moderna vaccines in December 2020. And what's really important is that monitoring doesn't stop there. Phase 3 had thousands of volunteers, but now across Canada and the world, there have been millions and millions of people vaccinated. We continue to monitor globally to make sure the vaccines work and to watch for side effects. It's true that we often worry about things that are new or hard to understand. We are not all scientists and vaccine experts. But with more than 5 billion doses given around the world, we are now in a position where we've learned a lot, and we know what is safe and what will help to end the pandemic. To date, over 5.2 billion doses of the COVID-19 vaccine have been given worldwide. So we know a lot about the risks and the side effects. Just like with other vaccines, it's common to have a sore arm after getting the COVID-19 vaccine. This is to be expected. It's also common to have some tiredness, headache, muscle pain, or mild fever. These are actually all signs that the vaccine is working and that your immune system is responding to the vaccine and getting ready to protect you from the actual COVID virus. These symptoms go away, usually in 1 to 3 days, and they can be very easily treated using over-the-counter pain medication that you would normally take for a fever, headache, or sore muscles. The vaccine cannot give you COVID-19, but it is possible for you to get the COVID-19 infection from other people in the days or weeks after you receive the vaccine before you develop full immunity. That's why we say you are not fully vaccinated until you have had 2 doses and 14 days have passed from the date of your second shot. If you have a history of anaphylaxis or a severe allergic reaction and you're unsure if the vaccine is safe for you, talk to your family doctor first. The vaccine is safe if your allergy is not to a specific component of the vaccine. the risk of an anaphylactic reaction is very rare, between 1 to 5 for every million doses. Everyone is monitored for at least 15 minutes after vaccination so that if a reaction happens, it can be quickly and safely treated. If you have severe allergies, you might consider waiting for 30 minutes. Compared to this very rare risk of severe allergic reaction, COVID-19 has a death rate of 1.3% in Canada. That number may be even higher for unvaccinated adults with the new Delta variant. Some people ask if the COVID vaccines contain chemicals like mercury, formaldehyde, aluminum, or if they contain other drugs like penicillin. No, they do not. There's the medicinal ingredient, which is mRNA, along with additional ingredients. But the vaccines do not include those chemicals that people sometimes have concerns about. Although exceedingly rare, if you've had a severe allergic reaction to something called polyethylene glycol and polysorbate, which is a compound contained within the vaccine, you can talk to your healthcare provider to discuss what options are available to you. These substances are common outside of the COVID-19 vaccine and are found in some cosmetic products and in some very common over-the-counter medications like many Tylenol formulations or coated aspirin. I would like to talk about some of the common questions that I hear from my patients. Are the vaccines safe for women who are thinking about getting pregnant, are currently pregnant, or are breastfeeding? As a family doctor, I have delivered hundreds of babies, and this is a conversation I often have with women and their partners in my office. The good news is we have data showing the safety of these vaccines in pregnant individuals. The vaccines are not a genetic therapy, and they cannot interrupt anything with genetic sequences within your body or your baby's body on a permanent basis. We also know that women who are pregnant and get COVID are at much higher risk of serious disease, including being on a ventilator and death. Their babies are also at high risk, with much higher rates of preterm birth. It's also important for pregnant women to know that if they do get COVID-19 while pregnant, they're at a higher increased risk of serious illness and preterm labor. Because the vaccines are safe and because the risks of not being vaccinated are so high, the Society of Obstetricians and Gynecologists of Canada strongly supports vaccination for those who are considering pregnancy and those who are pregnant. This is the same recommendation as similar expert bodies around the world. With the increasing case rates being driven by the highly contagious Delta variant, I encourage women who are pregnant or thinking about getting pregnant to be vaccinated. This will protect them and their babies. Every vaccine is monitored continuously once it is produced. Canada monitors this at the federal level with input from all the provinces and territories. Canadian officials are also in continuous communication and contact with international counterparts to collect data together and study vaccines' adverse effects and safety. Safety is a global effort. There are reports of myocarditis, which is inflammation of the heart, or pericarditis, inflammation of the heart lining, that have occurred with COVID-19 vaccines for teens and young adults. These are more commonly reported in young men and after the second dose of the vaccine. This reaction is uncommon, about 12 cases for every million doses, and fortunately, almost all cases resolve quickly with or without treatment. What many people don't realize is that being infected with the COVID-19 virus can also cause myocarditis and pericarditis. In fact, the risk of myocarditis with COVID-19 is much higher than the risk of myocarditis with the vaccine. Do I still need a vaccine if I've already had COVID-19? Yes. If you have already been infected with COVID-19, the vaccine will help you stay protected longer. Plus, for travel and other opportunities, it may be easier or even necessary to show evidence of vaccination. What do religious authorities say? All 5 major religions have told their congregations to get their vaccines. The Pope said that individuals are morally obligated to get vaccinated, and that choosing the vaccine is choosing life. Well over 5 billion doses of COVID-19 vaccines have been administered worldwide as of August 23, 2021. There is no longer anything experimental about these widely used vaccines. Contrary to what some people online are saying, Health Canada has issued full approval for these vaccines. The FDA has now done so for Pfizer as well. In fact, we have more safety data for these vaccines than for many others. Isn't COVID-19 just the same as the flu? There are some similarities between COVID-19 and the flu, but also many important differences, such as the severity of illness and the risk of death is greater with COVID-19, transmissibility is greatly increased with COVID-19, and long-term symptoms are much more likely with COVID-19. COVID-19 vaccines are even better than the flu vaccines at stopping infections and severe outcomes. Canada has a good supply of vaccine, and getting your first and second doses is easy. You can book your appointment through the Government of Ontario website. I do hope this was useful and helpful. And please note that at any time, your primary care practitioners like myself are available for you to discuss additional questions you may have. For more information, you can visit Ontario's vaccination program website or call the Provincial Vaccine Information Line, or you can contact your local public health unit. Please, let's all do our part to end this pandemic.